morning to you all. A very big hello to all the thousands of people who listen to the platform. Lovely to have you with us. And what a day it is. It's the first day we've broadcast outside the tyranny of COVID. The age of COVID is over. Why do I know that? Because I went and I played homage at the Pillar of Truth yesterday at a Beehive press conference, and Chris Hipkins told me that COVID was over, that it had been tough, but the sacrifice was worth it, and he was so happy to be able to tell us that forget about that COVID thing, yesterday's news. Aisha Verrill flanked him, and we are told that all measures to do with COVID, all measures, all restrictions are gone. You don't have to wear a mask anywhere. There are, he says, no mandates left anywhere. Though, if you work in the health sector, there's still requirements for you to have certain vaccinations, and the COVID vaccination may be one of them. But it is over. We beat it. We lost about 2,000 people. And there was massive, massive disruption to our society, to our education system, to our business sector. Thousands of New Zealanders were stranded overseas, unable to return to their home country because of government policy. We enforced draconian restrictions on people in terms of simply going about their everyday lives, and a level of paranoia seemed to infect the country. And amongst the 3 years of COVID that we have lived with, we began to rely on experts. And there were a wide variety of them, of experts. Foremost probably was Dr. Bloomfield, who led the official experts in advising the government. And while Chris Hipkins apologised yesterday for the length of some of the lockdowns, in particular to Aucklanders, he failed to mention that oftentimes our cabinet, our politicians, ignored the advice of our experts and Dr. Bloomfield in continuing more draconian restrictions than the officials said was necessary. And a bit of the stuff I've read says really it was a game of two halves. The first half, while we had no COVID and no one was dying, so the first year and a half was great for the government, and then it all went sideways. And I think we were all over it. One expert here at the platform who we have talked to a few times on this, and I actually think has always given his best and most honest assessment, though I'm sure a few of the anti-vax nutters will lose their stuff over this, has been Professor Michael Baker. So I thought it'd be good, actually, on this day of days, when finally the evil dragon has been slain, or we're told it has, he'd be a good guy to talk to. So we're joined now by Professor Michael Baker. Michael, nice to have you on the program again. How are you?
Yeah, sure, Sean. No, I'm very good. I've actually just got back from 4 months of study leave overseas, which has been really great.
Quite healthy for you, I would imagine.
Yeah, very much so.
Because it was a maelstrom. Look, first, let's just get to what Chris Hipkins has said, and you can't not look at this in a political context. And many saying it is an attempt to distance from the bad days of COVID under Jacinda Ardern and wipe the slate clean, which brings me to my first question. In your assessment, Michael, is it the right time to declare the COVID thing over, to remove all measures we had to fight it?
Yeah, well, look, I do agree with what you're saying, but there's obviously a lot of fine print in all of this. Firstly, we know that this virus has not gone away. It's just transitioned from being technically a pandemic to being an endemic infection. And that's not necessarily great, because it means it's with us the whole time. And it's still our leading infectious disease cause of death and hospitalisation. So it's still a big problem. The second thing is that the behaviours that the mandates were requiring, and it wasn't, I don't think people were being prosecuted if they didn't do these things.
But they were losing their jobs, some of them.
Okay, so with the self-isolation requirement and the mask requirement, I don't think anyone's saying they're not a good idea. I mean, I think if you go to a hospitality venue, you don't want the person serving you to have a raging COVID infection or influenza. So I think it's, even most employers, I hope, would say, yes, we don't want sick people coming to work and infecting their co-workers.
And that's generally the rule for all sorts of things like the flu or a cold. You don't come to work, you stay away till you're better, and you don't give it to anyone else. But that's common sense, or it used to be.
Well, yes, but I would say most of us know of situations where that's not the case. And I think I fully understand, if you're self-employed or you're a struggling business, you're probably going to just soldier on. And I can fully understand why that happens, but it's not good. And I think we've had a culture in New Zealand of not actually, particularly with respiratory infections, following those guidelines. We've just kind of probably taken some medication and carried on. And so I'd hope that's one of the long-term changes that we do understand about these respiratory infections and how infectious they are.
Is COVID now notifiable? Do you have to tell health authorities if you get COVID, or is it just like having the flu now?
Well, it's still a notifiable disease. Yes, so that's a really good question. It hasn't come up very much, but yes, it is. It's on the list.
And always will be, well, for the foreseeable future.
Yeah, I mean, it's notifiable by the diagnosing doctor.
Not by you. You don't. Yeah, okay.
That's right.
So otherwise, there is nothing about COVID that lingers in terms of public measures or legal measures to cope with it. It's gone, if you like.
Well, look, I'm sure many employers, and including the Te Whatu Ora, will be requiring mask use, for instance, in many clinical settings. And I know that many doctors will be requiring mask use in their waiting rooms, for instance. So it's basically, in a way, the decision-making is being devolved more to a whole wide range of institutions, and it's not obviously a legal requirement anymore.
What about vaccination, particularly amongst health workers and in the health sector?
Yeah, well, again, I think we understand now that vaccines are very protective for staff, and many employers may say, look, it's a requirement from an occupational health and safety perspective that we do everything we can to protect our workforce. And they're perfectly entitled to have this as a requirement for new staff members.
Are we confident, or would you be confident, Michael, that the vaccines as they stand are safe and effective?
Well, everything is always relative, and I've been reminded during the pandemic that we need to always say that nothing is totally effective or totally safe, and we know that across all healthcare, everything we do. But the balance is that vaccines are still effective at reducing your chance of getting infected or getting seriously ill and going to hospital and dying. So there's no question about that. And they are relatively safe. I mean, we know that the mRNA vaccines do carry a small risk of myocarditis, and at least 2 people in New Zealand are known to have died following the vaccination after something like 13 million doses. So there is a risk, but the risks compared with the benefits are tiny. The benefits hugely outweigh the risks.
All right. Michael, it was the age of experts and graphs and data and the podium of truth. You were one of those experts, there's no doubt about that, and there were others, and we think of Susie Wiles and various other people who popped up. And there was a backlash against that, and I think it was a natural and human reaction to the sort of restrictions that we were asked to undergo and undertake. And look, it wasn't perfect, and in retrospect, some of them were poor restrictions or policies that didn't work well. As one of those experts and leading experts, how do you think experts as a whole have come out of COVID? And I just wonder if you got any personal reflections on what toll or what advantage the time of COVID had to you.
Yeah, well, I did feel in some ways that I had been rehearsing for this for quite a few years, because I'd actually had 20 years of studying pandemics, and I'd gone overseas and talked with groups and done work with the World Health Organization on things like the International Health Regulations, which is this global treaty. So I'd thought about pandemics a lot. And interestingly, we just published a paper before the pandemic about under what circumstances would it be justified to close borders. And of course, people said, oh, well, that's never going to happen. So it was, at certain times, I almost had to pinch myself to say, look, this is really happening. And basically, I'm one of the people who needed to step up, because, you're looking around and you're saying someone should say something. You think, well, perhaps it's my turn, because I have been researching this area for a long time. But I don't think any of us were prepared, whether you're an expert or you're living in New Zealand at the time, for what was going to come.
All right. We were told that all the drastic measures we took, staying home, literally locking up our population for months, had the point of not collapsing our health system. Our health system actually, by the looks of it to me, never got anywhere near collapse. It's just as likely to collapse, or more likely to collapse, from the incompetence, for example, of the current health reforms than COVID itself. Were we ever even close to the edge?
Well, we weren't, and there's a good reason, and that is because we had an elimination strategy, and it meant that the virus didn't run wild in New Zealand when we were unvaccinated. And one of the things going overseas and meeting with groups really across Europe and the UK is just how grim it was in those earlier periods. And all of the people, all the doctors I talked to and others, health workers and researchers, said they all know people who died in the front line during that period. Just basically, the system was completely overwhelmed in countries, particularly the UK, and it was horrible. And we avoided that. So I think we have a huge amount to be thankful for the New Zealand response, particularly during those first 18 months when we were largely virus-free. And the other thing is, we've now got publications coming out on this, when you quantify the level of restrictions in New Zealand, they're the lowest in the OECD. We had less restrictions than virtually every other country, every other high-income country. And again, we couldn't, the restrictions we had, of course, were, frustrating, but they were nothing like what most people in the UK and European countries had to put up with, including Sweden, I should say, for almost 2 years. So we've got to actually look at the data and not just go on our emotional response.
Yeah. Michael, I'd also say, though, COVID isn't over. I think the legacy of COVID will live with us for quite a while, and I think one of the things we failed to do was to assess the psychological impact on a nation, on people, of the measures that we were implementing. And I look particularly at young people. I know I've got a 24-year-old son who was at university at the time. He has missed and had a completely different experience of university that he expected. We had a large number of people living with social isolation, particularly, again, children not going to school, being separated, not seeing other babies, not having normal social interactions. I actually think there's still a price to pay on that, and that legacy. And we look, I guess, at the rise of the anti-vax nutters and that movement. These are all consequences of COVID that do not disappear overnight.
Yeah, look, I totally agree. And I really think we need to describe these consequences and work out how to do it better if we get anything like this again, which I think we, as a sensible country, we need to plan for a whole range of scenarios, whether it's pandemics or more climate disruption or armed conflict and so on. These are just the sort of things that we need to have on our horizon. And of course, there is a Royal Commission at the moment, which is hopefully going to... Well,
pretty restrictive. It's got a pretty restrictive remit. I don't know we're going to get to the bottom of a lot of stuff people want to get to the bottom of, Michael.
Yeah, well, there is a question of... we could go to the UK model, which is sort of 5 years with judges and lawyers to try and get to the bottom of everything that happened during the pandemic. But I actually do think having a forward focus, which I think the current Royal Commission does have, is actually really desirable because you can't look at everything. It just, I think the priority is how do we do it better next time?
Yeah. Look, I'm getting lots of texts now. What about all the thousands of vax injured? How many people were seriously injured by the vaccine in New Zealand? Do we know?
Well, we've got a good surveillance system. Basically, if there's any suspected vaccine injury, it's reported. There's a national reporting system. Also, there's data linkage, which looks at what the mortality risk is in the 3 weeks after getting the vaccine. And this is very interesting, as your mortality risk drops. It's much lower amongst vaccinated people compared with the background level.
Yeah.
And it's partly a healthy vaccinee effect that people who are sick don't tend to get vaccinated. So, but all of these things are telling us that there's a very low risk of serious injuries from the vaccine, and that fits with the global consensus.
Yeah.
And really, frankly, there are just absurd ideas floating around about...
Yeah. Well, I keep on hearing about this excess death stats, and to be honest, my eyes glaze over. What is the argument that the anti-vax nutters are making on excess deaths, and what is an excess death, and how do we measure it, and how is it relevant to all this?
Yeah, well, they're completely wrong in what they're saying. Basically, we're tracking. Anyone can look at excess mortality in New Zealand by just going on to Our World in Data. It's a publicly available data site, and this is tracked on a daily basis. And at the moment, New Zealand has achieved an amazing success. Our excess mortality throughout the entire pandemic and right up to now is hovering about zero. So we've seen no increase in mortality during the pandemic. And actually in 2021, when we were rolling out the vaccine, we had most of the vaccination in New Zealand, or the highest numbers were actually done that year. We actually saw excess mortality continue to drop to our lowest levels. So really there's no association over time or what we call ecological association between vaccination and excess mortality. And also when we look at individual level, we're not seeing it either. And if we look at what's reported internationally, there's consensus on this.
Okay, because they do seem to jump up and down about that, to be honest, Michael, quite a lot. But once again, I say there were psychological impacts which I think have resulted in the rise of that movement, the anti-vax sort of nutter and conspiracy theory movement. You did talk about we can be better prepared in the future. And I will raise this. A lot of mistrust of the World Health Organization and a lot of resistance to the idea that a country like New Zealand farms out responsibility for setting policy during time of a pandemic to some non-elected international organisation. Well,
firstly, we didn't follow the WHO's policy guidelines anyway. We actually did, we forged our own path. They basically advocated for keeping borders open and other measures. They weren't very supportive of mask use and so on. So I think they are doing a lot of soul searching at the moment about trying to do it better next time.
Yeah. But the anti-vaxxers tell me we've signed up to this thing where you've got to carry a WHO passport or the country's economy will be stopped. And
yes, that sounds very odd to me. But yeah, some of the ideas circulating around just have no basis in fact at all. I mean, you have to remember the way the World Health Organization works. It's a membership-based organization, and that's one reason why it's actually quite sluggish and actually has very little power in terms of determining what is done internationally, and it can't really make countries do anything.
Mm. Hey, how many people died from COVID in the period from, well, when it announced, when the Podium of Truth began, to the official announcement that it's all over yesterday afternoon?
I haven't looked at the numbers recently. I think it's around about 3,000, but again, it's just sitting on the Ministry of Health website.
Yeah.
And there are several numbers that are quoted, and the core number is the number of deaths that are attributed to COVID-19 after careful investigation. And that means a doctor has filled out a death certificate, and they put COVID-19 as the underlying cause. And so that takes a little while to come through, and those data are all collated by the Ministry of Health. I mean, this is a system that's been in place for decades, or probably even over a century in terms of assigning cause of death. And it's not perfect, because sometimes doctors won't have enough information. The person may not have been tested for COVID-19 before they died. So it's got limitations, but it's the best we've got. And this has been used for all cause of death reporting across the globe.
Well, the last time we had this was Spanish flu, right? That was a couple of generations ago. Does science tell us when we'll have another COVID-19? Do we wait another 100 years?
It would be nice if science could tell us that. I think the best analogy is earthquakes. And, as much as we'd like...
I hate that analogy, because it means we've got no freaking idea, Michael.
That's right, exactly. So what modelers and epidemiologists and microbiologists tell us is questions about the likelihood over a sustained period. You can't tell when or where or how bad. So all the things you really want to know are not available, but you can get an idea of the probability. I mean, with flu pandemics, there's about 3 per century, and this is going back several centuries. But some of them are very minor, like the 2009 H1N1 flu pandemic. It was definitely a pandemic, but it was no more severe than seasonal flu. So, as opposed to 1918, was horrific. It killed 1% of the population in 6 weeks. So there are scenarios that we need to be prepared for that I think no one would say is acceptable. I mean, if we had a 1918 flu pandemic rolling across the globe now, I think most people would say we don't want to lose 1% of our population in 6 weeks. We have to do something. So hopefully that will never happen in our lifetimes or even in the foreseeable future, but we do need to plan for it.
Well, as you said earlier, Michael, maybe in your lifetime this was your moment where everything you trained for was interesting and was useful. And you were one of the experts in this country and talked about a lot. It's over now. Is there a letdown? Do you fade away? Or are you left with a legacy of, certain people saying that you're evil and part of a global World Economic Forum conspiracy? What happens to all you experts when we don't need you to be experts anymore?
That's right. Well, I think that in some circles I'll probably always be some kind of unpleasant meme, and I do still get, on some of the unregulated sites, there's still very unpleasant comments. But look, there's so many other important public health, I think, challenges or opportunities in New Zealand. So I don't think any of us are going to be out of a job anytime soon. And I want to get back to some of the other things I've been working on, like rheumatic fever, housing and health, and climate change, those kind of areas, which I think are really critical challenges for New Zealand.
Michael, one thing I will say about you, you have fronted on the platform where many others wouldn't, and you haven't always agreed with me or with our audience, but you have been prepared to box your corner, and I greatly respect that. Glad you've had a break, and we'll catch up soon.
Yeah, great to talk, Sean. Thanks for having me.
Thank you. Professor Michael Baker, epidemiologist, one of the experts, but it's all over the COVID thing. I don't think it is. I think we are going to live with the consequences, and in some ways the psychological, political consequences of COVID for a long time. It was a desperate attempt yesterday by Chris Hipkins to draw a line under it, to distance himself from really the first year and a half. COVID was pretty good. The podium of truth was working perfectly. Everyone believed Jacinda, and then the wheels started to fall off as thousands of New Zealanders realised they couldn't come home or go back to their jobs. And it all became a bit much. And I imagine going forward we will want to look back and talk about it less and less. We'll be like, I don't know, war veterans who don't want to talk about their experiences with other people. They just want to get on with their lives.